Hello and welcome to Health Professional Radio. I'm Henry Acosta, the host for today. Today with us is Dr. Alberto Pinzon. He's a pediatric allergist and immunologist. He specializes in the treatment and management of diseases in infants, children, and adolescents that result from abnormalities of the immune system. Today he will tell us about all about the children and their allergies. Hi, doctor. Thanks for coming in today. It's a pleasure to have you on air.
Hi, Henry. My pleasure.
To kick off the interview, I just want to ask, can you tell us a little bit more about yourself and how you got into this line of work?
I've been fortunate enough to being able to chase the passion that I have for immunology. I received my medical degree from the National University of Columbia in about the year 1999. And at the time, I had a passion for study of immunology, the immune system, and the way the immune system actually influences most of the other aspects of life in general. So I engaged into a PhD in immunology at the University of Queensland, which I completed, and then started a postdoctoral fellowship as well in Queensland at the Queensland Institute of Medical Research. And that actually sparked my interest further in continuing this, and so I completed further training in pediatric immunology and allergy through the Queensland Health network of hospitals.
Since we're going to talk about children, what do you think are the causes for allergies from children, and how can you tell if a child has them?
I guess that's probably the million-dollar question. Why are we seeing such a dramatic trend in the incidence, in the prevalence, and the allergies in children in the developed world? And I guess the answer is complex, particularly because the causes we believe are quite complex as well. This is to be a multifactorial process whereby there's a number of things that have been implemented, and amongst them is the fact that as a society we're clearly now much more developed, we're cleaner, so our children are not exposed to as much immune challenges, and I mean things like infections or parasitic infestations or even recurrent infections. Now our children are being immunized against a number of diseases, which is obviously again expanding more each day. We're treating them promptly, and not only that, we're also exposing them less so to the usual environment. And in a way, this has taken hold as a hypothesis, which is postulated to be it's called the hygiene hypothesis, whereby the excess cleanliness and the limited exposure to children to these relation has led the immune system to be somewhat dysregulated and cause allergies. But there's a number of other things as well at play that I guess we're still trying to work, like the introduction of foods during diet, as well as the breastfeeding and what's the evidence about also microflora that we have in the gut and how the gut matures, a number of other things that seem to have been playing a role.
And so let's say I have a child and I'm still skeptical about introducing solid foods since I'm not sure if my child has allergies. What are the ways that we can work around with that?
Well, I guess the most important thing is to be safe. If there are questions, if there are concerns, it's important to seek assistance by child health clinical professional. And if there is no significant family history of allergies, the advice that we're giving is, when the recommendations are to introduce solids from early life when the children are developmentally ready. And usually that readiness manifests in infants between the ages of about 4.5 months to about 6, when they're starting to sit somewhat less supported, and they're starting to reach out, and they're starting to put things in their mouth, and they're starting to chew and more interested in their environment. And so at that time, you start off the introduction of the normal foods that you would otherwise introduce in a normal household, and then progressively introduce other foods. If you're concerned, obviously, the first thing is if there is, for example, a strong family history of allergy, one of the options would be to discuss these issues with a clinician. A number of things that we can do, but testing is not necessarily always the way, and I think testing for all the foods that are going to be potentially introduced is potentially quite onerous, and it's quite difficult, and it's not always possible. And that would lead certainly to delaying the introduction of food. So I guess the best word of advice is if there are risks, if there are concerns about these, then to go very slow and gradually. There is a number of resources available about how to do these, and I would recommend to follow through national guidelines as well as guidelines from the recognized professional bodies. And if there's been reactions, then we need to seek assistance from a health professional that will help us navigate, and that would be a pediatric allergist.
I see. And with regards to children, since sometimes that we don't know what they're eating, just in cases of emergencies, what are we supposed to do as parents or as the ones who are older, just in case of emergency? What's the first thing that we should do?
Okay, well, that's actually a very important point that you've just raised there, Henry. A number of children will have their allergies diagnosed at a later life, whereby they've been consuming foods and they've been they're carrying on their lives, and suddenly they're exposed to a food or a potential allergen that they've never been exposed to in the past, and they have a reaction. I guess the society and the community as a whole is now much more aware of the presence of allergies, as I use. Certainly the incidence of allergies has increased, and this has brought the awareness to the next level. If there is a reaction, there is very clear guidelines. The first thing is if it's a mild reaction and you're comfortable with the mild reaction, meaning there's only maybe the possibility of a rash, then we can provide treatment with antihistamines. If we're unsure, we need to seek help. If there is a severe reaction whereby there is involvement of the cardiovascular or the respiratory system, or there is evidence of anaphylaxis, which can be evident, by flopiness or pallor or respiratory distress or cough, then obviously that means that the child is having a severe reaction. And in that instance, the first thing to do is, if the family has an adrenaline auto-injector, is to provide. If the family hasn't had it because there's never occurred anything in the past, is to call for help, call an ambulance, and attend a medical center immediately.
That's some good advice. But and since we know that time moves, we can't stop the movement of time, and seasons always change. What can we do with regards to the allergies that comes with the changing of seasons?
Well, I guess you're referring probably more to the environmental allergies.
Yeah.
Environmental allergies tend to play a significant role more in the older population. In children, it tends to be somewhat more problematic. Certainly past infancy and toddlerhood, we tend to find that it can play a role in allergic asthma in later years, and similarly in allergic rhinitis, which is more of a problem of late, of early adolescence and late teenage years as well. With the seasonal allergies, I guess the most important thing is there will be evidence of a pattern to the potential triggers, and we should be able to try to identify those and try to prevent and minimize exposures to those. Usually there's going to be a number of things that people can get sensitized, are highly allergenic, and those include allergens such as pollens from grasses or from trees or even from weeds, include inhalants like the dust mites or even mold, even animal dandruff for that matter, that are subsequently, inhaled and cause a number of respiratory symptoms. The management for those conditions is the most important thing is being informed, be well educated. If there is mild symptoms, usually the treatment entails the use of antihistamines. If there is, for instance, evidence of rhinoconjunctivitis, but obviously if there is a flare in allergic asthma, the treatment should be as per an asthma action plan, which involves the use of bronchodilators and steroids on occasion. If the symptomatology is quite problematic in that it affects the quality of life, where the child is having to be referred to hospital a number of times, or is having difficulty at school or difficulty at performing activities and sports and etc. We should be seeing that child to try to guide families and management to maximize the treatment options and make sure they have a good quality of life, because it can be quite restrictive.
I see. And here's a question that I've been meaning to ask though about allergies in children. What's the biggest misconception that usually drives you nuts with parents about their children's allergies?
I guess one of the biggest issues that we are grappling almost head on at the moment is I guess part of the change in the demographics and the incidence and the prevalence of allergies, and is the misconception that the early introduction of food has been associated with an increased incidence of allergies. In 2008, the American Academy of Pediatrics recommended early childhood avoidance of highly allergenic foods, particularly milk, egg, and peanuts. And the assumption at the time was that was to prevent allergy. But we now know that this is, in fact, quite the contrary and may increase the risk of allergies. It's taken a number of years to complete studies from that point of view. In 2015, there was a very significant study published in the New England Journal of Medicine, which demonstrated that early exposure, and this is from 4 months, to peanuts in high-risk infants, and peanut was chosen because food is one of the most allergenic proteins, and then continuation through childhood reduced the risk of peanut allergy by as much as 7-fold. And similar results were found with egg and milk. And so, from that point of view, the early introduction, as I mentioned earlier, 46 months when the infant is developmentally ready, of all foods, including allergenic, is now recommended. And I guess this is I cannot stress this enough.
And what do you want our audience to realize or to learn from this interview?
Well, I guess that children with allergies in children are very common. It's important to seek medical assistance and support when there are difficulties, when there are reactions, and we're trying to clarify and find a way forward to navigate through the multiple allergies. Also to recognize that children need to be introduced into foods at an age when they are developmentally ready for these. And this includes, as mentioned earlier, allergenic foods. And so not to be scared, but to be pragmatic, to introduce foods, to introduce the highly allergenic foods in a graduated manner. And certainly if there's concerns, if any of these are affecting the quality of life of the child, to seek help from a qualified professional. There is a lot of potential resources that can be made available to families and children with allergies, but unfortunately, in amongst all these, there's obviously unorthodox practices which cause more harm than benefit. And so I recommend to seek for people that are professionally qualified and that are registered with the board, the medical board as such, that will help you with these and try not to feel prey of a number of unorthodox practitioners that will certainly cause more harm in his child's life. But from that point of view, there is a number of resources that are readily available, and I can recommend families with children with allergies to refer to websites of the Australian Society of Clinical Immunology of Allergy, which is allergy.org.au, even to Anaphylactic Australia, and navigate their way through that and get some information about practitioners and about help and about the assistance that is available, and then come and see any of us to help you guide the way through.
All right. And for our listeners who are interested in reaching out to you and maybe having their children checked by you, how can they reach you?
I am based at Greensfield Private Hospital at Greensfield Paediatrics. The best way to contact us would be simply by looking at our website, which is greenslopespediatrics.com.au, or even by doing an internet search. I'm sure that our information will be available. We have a number of blogs online as well that are addressing some of the issues that I discussed, and there will continue to be more coming through. And remember that we're here to provide a service, so we will be from the diagnosis through to the management, including oral food challenges, to rule in or rule out the presence of allergies. We can't perform all of those.
Awesome. Well, that's all our questions for today, and thanks for coming on the show, Albert.
Thank you, Henry. I appreciate your help and your time.
And that was Dr. Alberto Pinzon, pediatric allergist and immunologist. And we just finished talking about children and their allergies. I'm Henry Acosta, and you've been listening to Health Professional Radio. You can find us and this interview on www.hpr.fm. You can also find us on SoundCloud and iTunes.